Hi, my name is Devin Romano, and I did my immunology report on vitiligo. So vitiligo is a disease, an autoimmune disease, in which the immune system attacks the pigment cells in the body, also known as melanocytes. Those are the skin cells just underneath the layer of skin. And this causes skin to lose its natural color, also known as depigmentation. So symptoms of vitiligo include color loss on the skin, especially the hands and the face. It can also include color loss on your hair, such as your eyebrows, eyelashes, even on the inside of your mouth. Occasionally, the skin that's affected can be itchy or painful, but this is generally rare, and more likely it has no detrimental physical effects except for the color loss. However, there are emotional effects as a result of vitiligo, such as low self-esteem and depression. There's also a further susceptibility to other autoimmune diseases, such as Addison's disease, or thyroid disorders, or diabetes mellitus. Anyone is susceptible to this disease, so there's no preference, there's no group that gets it more than any other group. They do notice that if you're going to develop vitiligo, it generally happens before 20 years of age. And in 1/3 of the people who have contracted vitiligo, they have noticed that it's hereditary. So it's from some family member, though generally not a close family member, more like a cousin or a second cousin or uncle. And this disease affects 0.5 to 1% of the worldwide population. And if you have another autoimmune disease, such as Hashimoto's, they've seen an increased risk in getting vitiligo. So there are a couple types and subtypes. There's segmental vitiligo, which is what it sounds like, where it appears on one segment of the body. And usually it begins at an earlier age, so perhaps, around 5 or even 10. And usually it'll progress for a year and then it'll stop. So it will stop, the depigmentation process will halt. However, the other type, called non-segmental, this is the more common and it appears on several parts of the body, so it's not restricted to one section. And usually it will develop on the hands and the fingers and the eyes, around the eyes and mouth, or even on the feet. And rather than like segmental vitiligo, where it occurs for a year and stops, non-segmental can start and stop throughout the person's life. So the color loss can just keep continuing until there's no pigment left. So these are two images of non-segmental and segmental. As you can see on the non-segmental, the color loss is occurring on both legs. However, with the segmental, it's restricted to just the one leg. Some further subtypes of vitiligo are localized, where there are spots, but they're limited to certain areas. Where there's also generalized, which is also very common, somewhat similar to non-segmental, where there's some scattered patches, but it's not localized. And then there's universal, in which all pigment is gone. This is very rare. As you can see, the girl on the top left picture has gone through the universal, and so she has completely lost all of her pigment. So, causes of vitiligo, it is an autoimmune disorder, and so though they're still not the 100% sure of the mechanism, though what scientists have discovered is that vitiligo patients do have abnormal melanocytes, and so the body picks up on that abnormality, and as a result, the adaptive and innate immune system attack as if it was a foreign object in the body. The way the adaptive immune system reacts, so the CD8 cells are actually found in a higher frequency next to dead melanocytes. And so we know that CD8 cells are capable of killing melanocytes because of them being next to dead melanocytes. And they've seen CD8 cells move from unaffected or from affected skin to unaffected skin. So this way we know that they do contribute to the pigment loss. The B cells also are involved. What they think is that self-reactive B cells, so B cells that should have been selected against, actually produce antibodies against the melanocytes, which also leads to their death and then the depigmentation. So the way that the innate immune system reacts. So the innate immune system has pathogen recognition receptors, or PRRs, and melanocytes, when they're abnormal, actually release damage-associated molecular patterns. So the innate immune system recognizes the DAMPs, and then the innate immune system sends a signal to the adaptive immune system, which causes the adaptive system to come in and start killing the melanocytes. However, one thing they don't know is why the melanocytes are abnormal in the first place. And some theories are that it could be genetic, that it could be because of UV damage, but that is one area that is not well known. There is also a genetic correlation with vitiligo. So they do think that genetic makeup can cause a higher risk in contracting vitiligo. If you have a family member or a close relative who has it, then you could have higher chance. And again, they're not 100% sure why this is. They think it could be perhaps a family member passing on a higher weakness to light, or some kind of chemical, or like some kind of chemical weakness. Variations in the NLRP1 and the PTPN22 genes are also associated with increased risk of vitiligo, and this is because the NLRP1 helps regulate inflammation and the PTPN22 helps control the activity of the T cells. And so if one of those genes, something happens to them or they are mutated, then there could be a greater response than necessary to melanocytes, which can cause the attack of the pigment cells. So there are several different treatments for vitiligo. So there are cosmetics, skin medication, light therapy, PUVA light therapy, surgery, and complete depigmentation. However, the first four are only treatments that work for a short amount of time, but none of them are very permanent. And so that's why typically, if you're going to get those treatments, they're expensive and it's not guaranteed that they'll work. Whereas the last two are permanent, especially the last one. Topical treatments, generally things like makeup is the cheapest and safest option. However, there is a disadvantage with makeup because I have to keep reapplying it, and sometimes if you have so much color loss, then you can only put on so much makeup. Also, there are some medicines that can add color to the skin. For example, there's corticosteroid. However, this works in 45% of patients, and it takes a while for it to work, about 4 to 6 months. It also works better for people with darker pigmented skin, and it only really works on the face, so it's not useful for other parts of the body. And there are some risks associated with using this steroid. It can cause skin atrophy, which can make the skin more fragile and easy to break. Light therapy includes using light boxes, so where you put your face up against the box and let the light on your face. And then there's also lasers. So the light box is for a wider range, so you can use it over your body, whereas lasers are usually more for small areas like your face. This is seen to be effective. However, it is required you need consistent treatment, and the results can disappear over time. So it is costly, and then even if you get this treatment, it could disappear. Another light therapy option is PUVA light therapy. So this is a combinational treatment in which you use UVA light and a drug called Sorlin, and you can use this drug orally or topically. This has also been seen to be fairly effective, about 50 to 75%. However, again, this is a time-consuming treatment and it is expensive, and it's not guaranteed that the effects will last. And there are also some side effects. Psoralen can have a negative impact on the eyes. It can damage them. And so it kind of is a scenario of weighing the balance of, is it really worth it? Then there are permanent treatments. So there's surgery, which is really not recommended for children because it can be risky. And what they're doing is they're taking skin from parts of your body with natural color, and they're placing it in the color loss areas, like this picture on the top left. This has been seen to be very effective, but it's really recommended only for those with stable adults, or only for adults who are healthy and stable. And there can be side effects, an infection, failure if the skin does not accept the skin from the other part of the body. And there can be an effect called cobblestone-like skin, where rather than the skin melding together and looking like natural, it looks kind of patchy, and then it doesn't really look as good. And then the final and most permanent thing you can do is depigmentation, and that just removes the remaining pigment all over the body. This is not a common treatment, and it's really only recommended for people who really only have a little bit of pigment left. So the way that this is done is there's a daily cream that they must apply for 1 to 4 years until all of the pigment is gone. And one famous person who has completed this is Michael Jackson, as an example in the bottom left corner. In conclusion, for those who don't have serious enough case to want to try surgery or who can't afford the medicine, one thing that they've been trying to encourage is acceptance and embracing the vitiligo, to see it as something not to be ashamed of, to something to see as beautiful. And so there have been an increased number of models, such as this picture, who are coming out with their vitiligo. And so that's one thing to work on, is rather than see this as a disease, to see this as something else to make you unique. So that's the end of my presentation. Thank you for watching, and I look forward to your questions on Friday.